Good morning, everybody. Whoever is attending my lecture series, today I am discussing the diabetes mellitus and anesthesia. Now, risk factors for type 2 diabetes mellitus. The commonly described risk factors for type 2 diabetes mellitus are encountered. Recommendations for glycemic, blood pressure and lipid control for adults with diabetes. Glycemic control is fundamental to the management of diabetes. A management plan to achieve the normal or near normal glycemia with an A1C goal of less than 7% should be developed for diabetes management at the time of initial medical evaluation. Goals should be individualized and less stringent treatment goals may be appropriate for patients with a history of severe hypoglycemia. Patients with limited life expectancy, elderly adults, and individuals with comorbid conditions taken from the ADA standards of care provide summary of recommendations for setting the glycemic control goals for adults with diabetes. Glucotoxicities. Hyperglycemia is an important factor in the production of widespread deleterious effects of diabetes, particularly evident in the cardiovascular and neurological symptoms. The major glucotoxicities are enumerated. At the cellular level, hyperglycemia is associated with an increased cellular redox state, oxygen stress, and decreased bioavailability of nitric oxide. Harmful low-density lipoprotein oxidation and evidence activation of procoagulant peptides. The accumulation of advanced glycation endorphin end products in diabetes promotes the cellular dysfunction and disrupts the vascular wall homeostasis through inhibition of vasodilation In addition, engaging the receptor for AGES, that is rage, a cell surface immunoglobulin, can potentially convert the short-term pro-inflammatory signals into long-term maladapted cellular responses. Through these and other mechanisms, hyperglycemia impairs the vasodilation and induces a chronic pro-inflammatory, pro-thrombotic and pro-atherogenic state as the basis for the commonly observed vascular complications in diabetes. Diabetes also impairs the glucose metabolism in the myocardium. Alterations in the glucose oxidation increases the levels of free fatty acids. Oxygen consumption and accumulation of free radicals inhibit risk factors for type 2 diabetes mellitus. Number 1, family history of diabetes, that is patient or sibling with type 2 diabetes. Obesity, body mass index, BMI 25 kg per square meter. Habitual physical inactivity. Race and ethnicity, as for example, African American, Latino, Native American or Asian American or Pacific Islanders. Previously identified IFG or IGT. History of gestational diabetes, that is GDM, or delivery of baby more than 4 kg of gestational diabetes or delivery of baby more than 4 kg. Hypertension, that is blood pressure more than 140 by 90 millimeter of mercury. HDL, that is cholesterol level less than 35 milligram per cent. And or a triglyceride level of more than 250 milligram per cent. Polycystic ovary syndrome or acanthosis nigricans. History of vascular disease. This comes to the end of my lecture discussion for today. I will start with my next lecture discussion tomorrow. Thank you.